Yeah,
Okay.
it is.
So your OET speaking task would last for 20 minutes. Okay. And it is specific to profession based on typical workplace situation. It means that you may, come across a patient who must be or might be having an issue, and you're going to solve that issue right away. It will be conducted in a private room. You will take part in two role plays. Okay. As I said, that whole task will be of 20 minutes, and you will have to work on two role plays. Each role play would last for 5 minutes. I may say 5 minutes, but you see, the any exam you give, it's pretty dynamic. So according to the conversation, according to the responses you give, the time variation will be there. Okay. And your focus must be on to expressing the best you can related to the situation. Okay. You take your professional role as a healthcare professional, as medico, while the interlocutor at this point of time, this interlocutor will be me. Once we are all accustomed with the role plays, we may interchange our stands. So let's say sometimes Kyle Young can be the interlocutor, and Clarissa can be the actual student or the medico who will be answering the questions accordingly. Likewise, it can work for Tricia and Kai Sheng as well, or Kyle Yang as well. Okay. Um, and now I would just like let's Clarissa to go about this heading about the speaking subtest. If you can please read it loudly for all of us.
The speaking subtest is delivered individually and takes around 20 minutes. This part of OET uses materials specifically designed for your profession. In each role play, you take your professional role, for example, as a nurse or as a pharmacist, while the interlocutor plays a patient, a client, or a patient's relative or carer. For veterinary science, the interlocutor is the owner or carer of the animal.
All right. So Kyle Young, if you can read the speaking subtest structure, please. Or Kai Sheng, if you can. All right. Tricia, if you can have go through it, please.
Alright, so in each speaking test, your identity and profession are checked by the interlocutor, and there is a short warm-up conversation about your professional background. Then the role plays are introduced one by one, and you have 3 minutes to prepare for each. The role plays takes about 5 minutes each.
All right. So before you actually start the role play or the task, they will ask you questions related to your profession. These are familiar questions related to familiar topics. They might ask you about your hobbies. If you remember the first day I've asked you about, in the similar fashion, they may ask you
Sorry, sir.
about, yeah,
We have
in
connection
this,
issue just now.
say that again, please.
Sorry, sir. We have connection issue just now, but now it's okay.
No worries.
Yeah.
No worries. Then in this case, we would like Kaishan, if you can read the heading first about the speaking subtest, please, loudly.
Yeah. So about the speaking subtest, the speaking subtest is delivered individually and takes around 20 minutes. These parts of OET uses materials specifically designed for your profession. In each role play, you take your professional role, for example, as a nurse or pharmacist, while the interlocutor plays a patient, a client, or a patient's relative or carer. For veterinary science, the interlocutor is the owner or carer of the animal.
Kyle Young, if he's there, please read the next paragraph with the heading the speaking subtest structure.
The speaking subtest structures. In each speaking test, your identity and professions are checked by the interlocutors, and there is a short warm-up conversations about your professional backgrounds. Then the role plays are introduced one by one, and you have 3 minutes to prepare for each. The role plays take about 5 minutes each.
All right. So if I can share the role plays, the task actually, they would look like this. All of you can please have a look. So before getting into a conversation, the interlocutor or the test taker will like to warm up the situation or to make you familiar with the surrounding there or the system there. So they will ask you, they will the person will ask you your name or full name plus the identity card that you have, possibly your passport, and then there will be a few questions asked which are based on familiar topics. As I said earlier, these familiar topics could be the questions would be of on your hobbies. They may ask you questions related to your academic journey or your professional journey, if any, and let's say the hours that you study and about your family members or about your friends. So this warm-up session is just to make you familiarize or make you comfortable with the situation. All right. And once you will receive this the role play card, you will have 3 minutes to prepare for the task. If you can see here, uh, on the right hand side you have the role play, and the first portion is of the patient, which is going to be me in this case in for the today's lecture. Okay, and there are some details mentioned here, specifically the details of the patient and the condition he or she is suffering from. If he is not the patient, he probably be the caretaker or maybe some relative. Okay, and we'll get to the actual task. However, we'll complete this overview first. So for that matter, uh, Clarissa, if you can read the role plays for me, the bottom one.
Yes. You receive information for each role play on a card that you keep while you do the role play. The card explains the situation and what you are required to do. You may write notes on the card if you want. If you have any questions about the content of the role play or how a role play works, you can ask them during the preparation time. The role plays are based on typical workplace situations and reflect the demands made on a health professional in those situations. The interlocutor follows a script so that the speaking test structure is similar for each candidate. The interlocutor also has detailed information to use in each role play. Different role plays are used for different candidates at the same test administration.
All right. So the one I've shown it was the role play card. So you can have a look at it now. For this one here, here the patient had a fright and he had a bad bout of flu recently, and the person feels increasingly short of breath, and the patient also complains of a dry throat. This morning he thought he's not going to stay for long, so he couldn't catch just because he couldn't catch his breath. And for the same situation, he was worried that he's got asthma, and for that's the reason she has come to see you. Okay, and this is like something which you should know or understand, the kind of questions can be asked by the interlocutor or the patient, or the relative, or the person sitting in front of you. So I'm just showing you this for the first task, just because in the exam you would not be able to see what is there, in the what kind of questions the interlocutor is going to ask. So however, for our first session, I'm going to show you all these. He or she would be asking questions related to asthma, and the patient may ask you to want to know what are the causes and how it can be treated. Uh, Suppose if you get back to the overview, they may say that the role play is there, or it is the part of your test, just because they want to test your English skills, or rather spoken skills. They may not necessarily check your technical skills, the domain, right? That is medicine. They may say that but we still need to understand that you need to be fluent. You need to understand, in this case, for example, what does fright mean. Okay, and had a bad bout. Obviously it is related to English as well, but you should be aware of these words at least. If not, then at least very necessarily you should be clear of what asthma is. Is that okay?
Yes, sir.
Okay,
Okay.
sir.
Yes. And you may not need to, you may not have to speak nothing in detail or specific about asthma, or you shouldn't be defining asthma. But yes, again, here and there, you can add supporting points where regarding those how the patient should take care of himself or herself in such situation, and that will be an added advantage if you are little bit aware of what kind of symptoms or what kind of precautions do the asthma patients keep. Okay, so that was the part of the interlocutor, the patient. In this scenario, you are the doctor, and let's say the patient is me. You can call me Nav, Mr. Nav, or just Nav. And these are your bullet points, or these are your prompts. On these prompts, you have to act. Okay, if you can all please read this in your mind for me. The setting is a suburban clinic, and then the further details. Is that okay?
Yes, sir.
All right. So
Yes,
the
sir.
first, yes, all of you, is it all right? Should we begin?
Yes, sir.
See, so you see, we have called this task a role play. All right. So you have to enact the situation in which you will come across a patient who is suffering with asthma or having some issues related to asthma, and he's not sure whether he actually has it. Okay, and then like any other movie, you have scenes of you know discourse, like where the judge is asking questions to the or the lawyer is asking questions to the person who is a suspect, or maybe who is the victim or criminal possibly. Right, in the same manner you will have to actually pretend the whole system here, the whole task. And obviously, again, I would say that the test is very dynamic, and the key to this test is the presence of mind. You need to lie, you need not need to show off that you know something and you don't actually know. Right, for example, if like being an English teacher, if I may not know what afebrile mean, afebrile, may I know what afebrile means, Tricia or Kyliang?
There's no fever.
Yes. So let's say the term is new to me. If I'm not aware of this, you can simply say, can you please repeat the question? When the question is having this term afebrile, right? And if not, then you can ask to restructure the question. So there is nothing wrong if you are not aware of certain keyword or a specific term. The idea is to communicate in English. If you are thinking something, you can simply say, let me think, or if I can think over it, or I have not given it a thought, but if I can, what I can understand now is. So all such terms I'm going to helping you out with, and I'm already aware that you must be aware of all such things as well in a way. All right. The first thing I've told you about is the dynamic, the nature of the exam, where you have to show, you keep your, you have to be on your toes. You have to show the presence of mind, right? The second thing is you should, like as I said earlier, you should speak your mind. If you're feeling that okay, you need some time to think, you will not get such some time to think. But yes, you can always say, "Let me think," or "What I can think of." Okay. The third thing is that always be relevant. Whatever the question is asked, be precise to it or stick to it. For example, if someone asks you, can you tell me your full name, please? Clarissa, how would you answer?
Hello, my full name is Clarissa Siosini.
Absolutely. So you have used the keyword full name, right? Likewise, you have to be relevant with the question. If the question is asked in a way asking you to describe the particular situation, then you may define or describe the situation. If the question is about, like, highlighting or giving an overview of a, let's say for example, a movie or a story, then you try to keep your answer concise, short, and then only give the overview. Have I made myself clear?
Yes, sir.
Yes,
All
sir.
right.
Yes, sir.
Okay. Right. So overall, a person will be asking the questions, you will be responding to the questions asked to you. Now for us, being at this position, being a student at this level, for us this is one task, and you can do this. We will be practicing these such tasks in our sessions. At the same time, the most important thing for us to know is, like, what are the criterias which are there in the mind of the examiner or whomsoever tests us, on what criterias the person give us the score. Okay, so our focus will be on that, because when you know that, on what kind of analysis or on what kind of factors your answers will be evaluated, if you're aware of that, I would say you are there. Okay, so we are majorly focusing on that. And for that matter, I would request Kai Sheng to please open this task, reading this task loudly, or reading this particular information loudly, which is how is speaking assessed in OET.
Okay.
Kai Sheng,
So,
please.
yeah. How is speaking assessed in OET? The whole speaking subtest is recorded, and it is this audio recording that is assessed. The speaking subtest is marked independently by a minimum of 2 trained OET assessors. Neither assessor knows what scores the other has given you, or what scores you have achieved on any of the other subtests. Your test day interlocutor plays no role in the assessment of your performance. OET assessors' judgments are targeted and specific, not the general evaluations of candidates' ability in spoken English. OET assessors are trained to focus on how a candidate responds to the particular task on the day. They apply specific assessment criteria that reflect the demands of communications in a health professional workplace. Remember that OET is a test of English language skills, not a test of professional knowledge.
Perfect.
Candidates.
Yeah, then Kyle Young can continue it.
Candidates who are familiar with the assessment criteria and pay attention to the details of the specific role-play task have a better chance of demonstrating their ability in the key areas. Candidates who use memorized material or merely rely on techniques that work in other circumstances tend not to perform to their full potential in tests. Your performance on each of the 2 speaking role plays is scored against 9 criteria and receive a band scores for each criterions. The 9 criteria are separated into 2 different segments: linguistic and clinical communicative. Linguistic criteria, and intelligibility, the impact of your pronunciation, intonation, and accent on how clearly your listeners can hear and understand what you're saying. Fluency, the impact of the speed and smoothness of your speech on your listeners' understanding. Appropriateness of language, the impact of your language, tone, and professionalism on your listeners' understandings and comfort. Resources of grammars and expression, the impact of your level of grammatical accuracy and the vocabulary choice on your listeners' understanding.
Okay. So here, when I say intelligibility, it means the impact of your pronunciation, intonation, accent on how clearly your listener can hear and understand what you're saying. Remember the first day I've told you, it is not important that you have in your mind you have thought that I've spoken it correctly. The rather the most important thing would be whether you have been understood by the person sitting in front of you. So to have this clarity, this, to have this, level of fluency or pronunciation is really important. Okay, intelligibility at the same time also relates with the relevancy of the question. Just now I have asked about the full name of Clarissa, and about how you should relate your answers with the question. Okay, so that is one thing. Other thing is fluency. You know how what fluency is. I'm not the one at this point of time to tell you, because you have this global exposure. uh, However, I would like to say that here they are not asking you to do a particular, or to answer the particular task in a short period of time. So even if you, for example, to answer a particular question, even if you start like this, I'm just giving you a sample. Well, in my opinion, I think asthma is related to issues relating to breathe or whatever. So you can go that slow, right? What I'm trying to say is that you can think and then speak. Okay. This is the most important thing, and it makes the part of your fluency, like it is the part of your fluency. Okay, it is integrated with intelligibility, it is integrated with appropriateness of language, and it with this you can actually get good words, or the real meaningful words, and can express really well. If you would just if you would just be you, if you're just there and you're just reacting to the questions, it would not make that sense, because you should not be in rush. However, if you take time, understand the question, take your, like, put your like brains to it, go slow. But you should be very, very clear, and you should be very, very meaningful. This is what the logic is, right? And when I say resources of grammar and expression, it means using the correct word at the correct time, or again, relevant to the question, relevant to the situation. In a normal person's language, he may say the person is suffering from, or the person is not doing well. But in your terms, it could be very different. Or you may simply say that the person is afebrile, or the person is, suffered a severe attack of like something. So in that way, you should be using the vocabulary, and it will make a lot of sense. Okay. Uh, Such examples, very clear examples, I'm going to put forward according to the question type. Okay, so we'll now move on to the of other criterias of evaluate your assessment of speaking. Just give me a second. All right. Uh, yes, Trisha, if you can read these things for me, these points for me.
All right. So, fluency, appropriateness of language, and okay,
Sorry, you,
okay.
from here. Yeah, yeah.
All right. There are also 5 clinical communication criteria you are assessed on. Your performance on these is given a band score from 0 to 3. The criteria are relationship building, understanding and incorporating the patient's perspective, providing structure, information gathering, and information giving. If you want to achieve a grade B, you need to aim for the highest score in all the descriptors for each criterion. Candidates with grade B mostly achieve scores of 5 out of 6 in each linguistic criterion and 2 out of 3 in each clinical communication criterion. Here is a closer look at the speaking assessment criteria and level descriptors.
All right. So when you say relationship building, you know, this particular instance is related to understanding the situation of the patient. If the patient has just gone through certain periods of illnesses, and you know that he probably will suffer some serious conditions, right? So you need to empathize, you need to show sympathy with the patient. Or even if the patient is angry or is not happy with the situation, then still you need to make him calm down, and to use such words which will bring him calm or her calm down, to lower her level down, uh, are the are the areas which are called relationship buildings. Okay. For example, if a patient says, "Hey, I'm in rush and I need to see the doctor," what should you reply, Clarissa?
I think that we can reply, all right, sir, may I know why you are in a rush and may I know how can I help you today?
Yes, you can say that. And sometimes we simply say that I understand your situation. Please allow me a minute. This is also all right. So all these structures, like, according to the situation, they can be built. However, as I said, I'm going to help you with these structures. I'm going to provide you these structures as notes, uh, later on in the session. Okay. Now, when you talk about understand the second point, understanding and incorporating the patient's perspective, what does that mean? And can anybody guess?
Could it be being empathetic from his perspective?
Yes, you can say that as well. The other thing would be, for example, the patient is there and he's talking about, the shortness of breath and the period of fright. Okay. The period of, extreme coughing or something like that. So you got to take clues from those, from his answers or her answers. So he says, for example, I was, experiencing a shortness of breath and I completely died in that situation. So your response should be, uh, the shortness of breath, for how long it lasted. Okay. And may I know, like, why did you feel like you completely died? So use taking the structures from the answers or the points of your interlocutors or patient's response and using them and making in order to understand the situation and making him understand the situation and how you're going to help the person or the patient. Okay. Is that clear?
Yes, sir.
Yes.
Yeah. And for all of you guys, remember, when it's you should understand it. If it is not clear, you can obviously ask me to explain again. But you should not feel that if the other person has said okay, you should also say okay. I mean, I'm just making my stand clear. If you have any questions, you can always ask. Be comfortable. Okay. Then jumping onto the structure, providing this structure. Providing this structure basically means, enabling the patient to answer and explaining why he or she has suffered the situation, what kind of treatment, like in details, like in points. First of all, I'm going to scan you through, or I'm going to take your vitals, and then on we will book an appointment with the doctor, like the structure of that kind. Is that clear?
Yes, sir.
Yes, sir.
Yeah. Again, these points are all integrated. So you say information gathering, information giving. So you may have understood, like, from the term information gathering, meaning, at what point of time or during what time you suffered this attack or this kind of situation, or was it the shortness of breathing, or were you breathing heavily? So this is information gathering. And when you're giving information, it could be like probably for the treatment or the dosage that you should take, or any kind of suggestion, or to visit again, or you have to see the doctor in the future or maybe in coming time. All such things relates to the information giving. Okay. Now you see this, these five structures or the criterias, will allow you to score, uh, you know, a band score from six. Like, overall the score will, the maximum band score will be six, and after that you should score a five. And whatever I have said till now, again, it relates to being present, having the mindfulness, having showing presence of mind, and be active. So you I'm showing these points or the assessment points just because that you should understand there can be n numbers of criterias, but your job is to communicate well. You got to speak efficiently and relatively. Okay. All right. So in your case, candidates with grade B mostly achieve 5 out of 6. Okay. And in each linguistic criterions are the ones we've discussed earlier. Okay. So these are the linguistic criterions, and the one we've just now are your, the communication criteria, clinical communication criteria, and you need to score 2 out of 3 in each clinical communication criteria. Remember that. I'm going to share all these, stuff with you. If you want, you can also take a screenshot so that you can remember. Okay. Now we'll jump onto the actual task. May I know if anyone can start, or anyone is ready to go about the first task? Clarissa, Tricia, Kailian, Kaishang, anyone, like, we simply have to go, start this role play.
Hi, sir. I think I can start.
Yes.
Just want to let you know that my English is not really good.
No, you guys are up there. You you just have to be there. Like, you don't have to worry whether what kind of level you got to speak, or you don't have to speak. Don't worry about that.
Okay, sir.
So this is the first time, so I'm keeping my role card as well, so that you will also know that how I'm going to make questions, using these role play points or the prompts. Okay, so this one is it Tricia who is ready, or Clarissa?
Yeah, it's me, sir. She's here.
Okay, so this is your, let me just put mine as well again. Okay, so for today, you're having a look at mine as well. Okay, however, further on, I will be uh, only sharing your role play card only. Just a sec. Okay, let's start with this. Is it visible to you,
Yes, sir.
Tricia? So this is your
Yeah.
section, and this is mine. Okay, Kailiang, Kaishang, and Clarissa. You can always give your inputs if there is a requirement. You can always ask questions if there is any. Okay. Okay.
Okay, sir.
All right. So, Tricia, let me begin first. And we are actually in the test now, and it will begin like this. Hi, my name is Nav, and I'm your interlocutor for today's test. These are my, IDs. And can I know your full name, please?
Hi, Mr. Nav. My name is Tricia Deng Wei Han, my full name.
Okay. Can I see your passport as well?
Yeah, this is my passport.
All right. Tricia, may I know where you come from?
I'm from Malaysia.
Okay. And if you can tell me, I should have asked this question earlier, but just now also, please, can you tell me how may I address you?
Sorry, sir, could you repeat again?
How may I address you?
You can call me Tricia.
You can say, please call me Tricia. So,
Oh, Please,
when,
courageous.
when you see, it's not for me, but when you use please, kindly, so you're showing empathy, you're building a relationship, you're showing respect and taking respect. Okay. uh, right,
Okay.
so yeah, that question again, can you please tell me where you come from?
I'm from Seremban, which is a part of Malaysia.
Okay, you can add a sentence to this, please.
Oh, please.
No, I mean, you can add a sentence to this. Malaysia, and this region is specifically known for its food delicacies or for its cultural heritage. You can add this sentence. What I'm trying to say is that your answer should have at least two sentences minimum. You should not answer in a word or a single sentence. You should be making at least two sentences apart from your name and showing the passport.
Oh,
Okay.
understand. Mm.
All right. So, do you work or do you study, Tricia?
I'm currently study. I'm actually a fresh graduate from a Bachelor of Medicine and Bachelor of Surgery. Currently studying for the UKMLA exam, which is the exam for us to have an internship there.
All right. And what are your next 5 year plans?
My next 5 years plan, I plan to pass my exam, which is my UKMLA exam, and later on I would like to work in the UK as a doctor and get my master degree there.
Okay. So let's begin with this task. It's a
All right.
it's a suburban clinic, and you have this role play with you, this card role card with you. Spend some minutes in the exam. You will get 3 minutes. For time being, you can have at least one, and you can
All
read
right.
these prompts.
Okay. Sorry, sir. I got one question. The task given is to discuss the treatment, which is Ventolin. So about the form of treatment, such as like middle dose inhaler or nebulizer, should I give my own kind of treatment, or I just simply say one? I
You
just say
mean
the name of the medicine.
yes, yes,
The
it
third
should be all
one.
right. Yeah, yeah. All right. So should we start?
Cancer.
All right. Hi. I'm here to see the doctor.
Hi. I'm the doctor in the service today. So just now I gone through your file. Before I start, may I know what's your name, sir?
My name is Mr. Nav. You can please call
All right,
me
Mr. Nav.
Nav. Yeah.
All right. May I know what brings you today to the clinic?
Okay. What brings you today? Okay. What brings you today? So see, basically, I had a fright. I was terribly shocked just because I was having this period of flu, and I was feeling a great sharpness, a shortness of breath, and at the same time, I was also having a dry throat. It was like completely choked up, and I felt like I was going to die. uh,
All
and
right.
I was finding it very, very difficult to breathe. So that's why I come here, and I'm worried that it may not result me in asthma.
All right. Oh, so I'm so sorry about your situation. It looks very serious. But just now you say you had a fright. So may I know how badly you have your flu and your shortness of breath? What kind of activities that you cannot carry out?
See, basically, every few hours, I feel this period of extreme shortness of breath, and my throat dries out, and I'm just worried whether it's a situation that can lead me to asthma, and I just wanted to know that.
Oh, all right. So I understand your concern about asthma. So did you know like more about asthma? What kind of the condition is it?
I am simply guessing because I have come across a lot many individuals who, when feel shortness of breath or let's say any difficulty in breathing, then I just know them because take nebulizer or so they say that they are asthmatic. So I'm just thinking that is it the same situation I'm going through?
Yeah, I can say that in your situation, from what symptoms you're having, I think you had a disease known as asthma. So, do you have any more concern about what is your cause in this diagnosis?
Uh, See, basically, I'm not sure what causes it, but possibly my working conditions, or maybe I hardly smoke, and maybe it's just because of any foreign factor I'm experiencing this shortness of breath. Over the period of time, I simply had a flu, and I'm sure that it's just because of this flu I'm facing this situation.
Yeah, definitely. For asthma, it actually have different kind of factors. From what you're saying just now, it's like the external factor that causes you had asthma. However, if you have some inherited genes, which means your family members have the history of asthma, it also can cause you to have this disease. And plus, your predisposing factors such as you are a smoker and also your working environment can also cause you to have asthma. So may I know if you have any other concern about this disease?
Uh, it is just that if it is the situation, I would like to know how can I be treated.
Alright, so from the treatment itself, it said that you are having a fright and you actually have a very bad flu. So I would like to give you a treatment known as Ventolin, which is salbutamol. And this medication I will give you in a form of nebulizer since you have a very serious asthmatic attack. And nebulizer, I will put the medicine in the nebulizer for you to breathe in a mask and it acts as a dilator, which means it will relax your trachea so that bronchi, so that you will have relief of shortness of breath. Did
All
you
right.
understand about this medicine?
This is the first time I'm going to use it, so obviously I'm worried about it, and I'm sure you're going to help me with this. And there are people who basically misuse this medicine. Anyway, if you can just detail me further how I'm going to use this, and will it be safe for
Alright,
me?
so sure. So this medicine I will give you in a nebulizer form first. Once you relieve and you feel better, and then I will give you in the form of middle dose inhaler. So I will give you as a 2 puff per day, and you don't use it for long duration. So you can use it for up to 2 days.
Hello, Tricia, can you hear me? You guys, can you hear me?
We can hear you, sir.
So we
All
can
right.
I
hear
think
you.
she got disconnected.
Are you back, Tricia? So likewise, the conversation will go on. And remember, you guys have to keep relating with the prompts. Whatever the prompts you have, you got to stick to them. For example, the last second one says reassure the patient about the safety of Ventolin. Can you guys hear me?
Yes, sir,
Yes,
I can
we
hear
can.
you.
Okay. So is something wrong with Tricia's connection?
I think she's trying to come back nicer.
Yeah, I think she's having some net issue, but she will
Okay.
be joining us soon.
Anyway, so remember, it's no rocket science we're discussing. You have all the structures with you. For example, the last second point, if I can take the role of Tricia, I would say I have to reassure the patient about the safety of Ventolin. So I would say, Mr. Nav, you do not have to worry about taking Ventolin because you will come across a very sophisticated device, which is a nebulizer. You simply have to put the ampule in and keep breathing, or maybe use it for once and twice, and you should feel all right. However, it is important to keep the nebulizer back into the box and away from the children, just because one should the children or anybody who is not into this disease should not use it. So this is how you reassure the patient. And the last point, when it comes to deal with the patient's anxiety about the problem, emphasizing that it can be controlled and discuss the prognosis for asthma patient. Clarissa, can you talk about this point?
Yes, sir. Okay, so from what you have explained to me just now, I understand that you sound very anxious about this problem. However, not to worry, I will try my utmost best to handle your condition.
Perfect. And that it can be controlled and discuss the prognosis for asthma patients. Now they say, remember, the test takers are saying that, oh, we are not checking your technical knowledge, but they are putting words like prognosis. So definitely you should be aware of such words. Okay. All right. So that was your speaking task. Likewise, in our this is, you can understand, this week is the first week is your orientation week. However, we have tried to cover the task as well. Okay. Subsequently
Hi,
in our
sir. I'm
session,
back.
yes, Trisha, welcome back.
I'm so sorry.
No
Good to
worries.
be back.
Yeah, good to be back. So you can continue with the last second point. Can you please reassure the patient about the safety of Ventolin?
Oh, all right. Okay. So, hi, sir. So, for the medicine that I gave you just now, so you have to know that every drug we have to have a safety precaution. So, from that every two puff that I had given you, you cannot overdose. But if you feel that you get your symptoms getting severe, please come back immediately.
All right. So likewise, our conversation would last for 5 minutes, and you're
Mm.
already there. If you guys have understood a gist of it, it is absolutely okay. And I'm sure you would have taken the screenshot of this task,
Yes, sir.
right? And there, you might have taken the screenshot of these over test overview as well.